Hey, great Taco Tuesday. Taco Tuesday. Hello, Lupita. How you doing, Lupita? It's good to see you. Sometimes I see Lupita on Facebook, and sometimes I'll catch her on YouTube. Thank you for being here, Lupita. It has been a different kind of day in the city of Brownsville. I guess for me, it was very, very boring. I actually had to work today. I want to give a shout out to Joe.
Different kind of day in the city of Brownsville. I guess
For me, it was very, very boring. I actually had to work today. Shout out to Joe Valdez out there. Thank you, Joe, for bringing me lunch today. Nobody else uh, came out and bringing some lunch. Thank you, Joe. You're amazing. uh, Today we have Dr. Ed Hernandez. Dr. Ed Hernandez, how you doing, sir?
Hey, good evening, guys. Doing well. Just got home from work and sanitized and ready to rock and roll with you guys.
And of course, we got Frankie. How you doing, Frankie?
How's it going? Good evening, Dr. Hernandez. Hello, world. It's been a busy Tuesday for myself. Monday and Tuesday have been a little bit hectic, but so is life. Um, excited for today's show. Always glad to have Dr. Eder Hernandez here with us. So looking forward to it. Good evening, Erasmo.
Good evening. And just to start off on I guess on some information that we just received, we do have one new death in Cameron County, so that raises our total to 30 individuals who have passed away. Yeah,
Wow.
and we also have 10 new cases in the city of Brownsville. And out of those 10 new cases, we do have five of them that were community, not linked to previous cases or to travel. Uh, all these are ranging from the ages of 22 all the way to 91. Uh, I might have missed it. I'm not sure if any of those individuals in the city of Brownsville are related to any of the nursing homes. I don't know if it says on the bottom. I actually cut it off when I took the picture. Let me read. Sorry, I'm doing the rookie stuff. Spanish Wells in Bronzeville also had 10 residents and one employee who have tested positive. So that already increased. If y'all remember, we had six. Well, actually, we had three, one, then three supposedly, and then the mayor let us know that there was actually six individuals out there. Now there's actually 10 residents and one employee. So unfortunately for us, the numbers are creeping up in our nursing home as well. And one of the things I'm glad we have Dr. Hernandez here. One of the big questions that I have, Dr. Hernandez, is one of the things that the media shared with everyone was that the the patient that had come in from the hospital had gotten tested, and when he came into the facility, he was testing negative. But once he came into the facility, then he tested positive, and it's then that he came into contact with everyone else in there, including an employee, and I guess now all these residents there. With that said, they had tested the 95 residents, and those 95 residents had tested negative, as well as all the employees. But now we learned that 10 of those, nine of those residents are now testing positive, as well as employee. Why are these people testing negative and then turning out positive, sir?
Good evening, guys. So, I mean, COVID-19 is a novel disease. This virus, it is a virus, but it kind of have a mind of its own, and so our body reacts to that virus, specifically different responses that everyone has. So we can't put everything in the cookbook type medicine and say, on day one you're going to test positive. So more than likely, what occurred was they took a nasal sample and obviously took a sample of from the patient and obviously send it to the lab for RT-PCR analysis of RNA. Um, if you're early in the disease state, you might not have enough viruses or viral load for that to turn positive. And so we don't know what occurred. It is possible for, obviously there's human error, there's lab error, there's a lot of equations that can take place into this. So It's important to also discuss, like what we're going to talk about today, is antibody testing, because it can complement these PCR tests that we're doing. So it's an unfortunate situation. It is something that can occur to anyone. I don't know the ins and outs of that reality. I heard about it. I don't know when the patient was tested. You can test if you test on day 1 or 2 after exposure. You might test negative, but if you wait a week to 10 days later, you might you're more likely going to test positive. So I put a screen for Frankie, so you guys can kind of look at what the body is doing with your antibodies, to be able to tell you guys. So
Yeah,
that's
we'll go into the antibodies in a little bit. My concern is, having learned a lesson from Harlingen with what happened with Veranda and with Atrium, and you mentioned possible human error. I mean, are we going to be another Harlingen here in Brownsville with Spanish Meadows and possibly Solara?
I don't believe so. I don't believe so. I think the Brownsville community, our leaders, myself, have been very active in the response. So I believe that they're going to be there's a mandate by the actual governor to test all residents and all staff. And so that's not going through me, that's going through, there's different chains of command that's going through, but we're willing and we're ready to test every single individual that needs to test, specifically in nursing homes. And so that's something that's important. At this point, I think what you're saying is true. We need to learn what Veranda did wrong, right? And we need to learn from those mistakes. And so the only thing I can tell you is we have to test everyone in those facilities as the mandate says, and we need to be aggressive on the testing. So it is important to do that. The city of Brownsville is engaged with the public health director and the EMS director, fire director, to be able to get this done. So they're doing their part. They've reached out to us. I actually have a conference call with them this evening, about 9:30, which is the time I'm probably going to log off, and how to respond to this, and obviously provide what's needed. But you are correct. We need to learn from those mistakes. One death is one too many. So we're at 30. You
30.
mentioned that
Well,
is a problem.
our concern for the city of Brownsville, sir. I mean, and again, and maybe if you could help us understand before we go into your slides, one of the concerns of the city of Brownsville is then apparently we haven't learned that much from Veranda and from Windsor Atrium, because I guess something didn't go through in regards to taking care of our nursing homes. So again, uh, it's just with everything that's going on in regards to all the openings and all the mandates, I think that we're getting a lot of confusion. So
Correct.
these individuals and I'm all for the testing and everything, but is at this point the testing, I mean, what is it really doing for us? Because at the nursing home of Spanish Meadows, I mean, we tested everyone there. We tested everyone there, and then everyone came back with and bear my question, everyone came back with 95 positive negatives, and all in regards to the residents and all the staff were negative. And then a couple of days passed, and boom, it wasn't that way at all. I mean, are the tests failing us, or what? Why is it that they tested negative, and then now that all of a sudden everybody's turning out positive?
So the reality of those is it's important to know the disease, and so if a sample is taken too early on, you're more likely going to test negative until you have enough virus in your system. So there's obviously a human error, there's lab error, there's the tests are not 100% accurate, and those are extremely important to understand. And so I'm gonna leave it up to. I don't have a say so that anything that has to do with the nursing homes. We are very active in testing, and people in my office, people through the sports park. That's our goal, and our motto is to test anyone that needs to test.
Awesome.
But the reality is, the nursing homes are being addressed. It's not something that is going through me at this moment. They reached out to me, some executives from the city of Brownsville, and I have a conference call with them this evening, and
Right.
how we can work together and kind of get what they need done. But the reality is, nursing homes are obviously are at higher risk for many purposes, the age, comorbid diseases, and so it's important to contain it as soon as possible.
Ryan has a question for you, Doctor. I don't know if you can see on the screen. It says, Dr. Hernandez, I've heard some claims that those who are suffering through COVID-19 are deficient in vitamin D. Are there any supplementations that might help us should we contract the virus?
There is some studies going on right now that vitamin D deficiency affects your immune responses. So there is some talk regarding vitamin D deficiency makes you more prone. I think taking enough sufficient vitamin D, uh, vitamin D 5,000 units on a daily basis, which is what's recommended, is actually very good. And also vitamin C. Vitamin C helps exactly with immune response. Zinc as well has some properties. All of this has not been proven, and so we shouldn't focus on these. These are positive reinforcements, but these are not treatments or preventions for any sort. What we know works is the reality is social distancing, adequate testing, isolation, mitigation of the disease.
Thank you, Doctor. And Doctor, you had some slides for us, Doctor, in regards to Kawasaki disease.
So I think that in the recent weeks, we've seen that the New York mayor, the New York governor, Governor Cuomo, came out with some information regarding Kawasaki-like disease and syndromes in children, and so there are some issues going on. And Kawasaki disease is a very very unusual, serious illness, and it affects children. It has to do with inflammation. There could be cardiac inflammation. There's rashes. There's something called strawberry tongue. There's five different issues that can occur. But most importantly, is it causes a type of inflammation and vasculitis, which could be very, very detrimental. And so it's important for us to know if we have any children that have developed fever, swelling of their extremities, a strawberry-like tongue, rashes, conjunctivitis, inflammation of the conjunctiva. This child, needs to be examined for COVID-19. It's important. It's important to test children, and so we don't have to believe that children are immune to the virus. They're not. We need to test them as soon as possible. If you see any of these symptoms, the youngest we've tested and diagnosed at the sports park, we tested a 4-month-old boy, and that was done through our testing capability, and that turned out to be a positive case. So that was our youngest, a 4-month-old.
But the positive case in regards to COVID-19, not necessarily Kawasaki. Have we registered any children with Kawasaki disease here in our area?
From what I know, there hasn't been anything registered here locally, and this is an inflammatory process that you will see develop several weeks after the infection, and so it's just important for parents to know those symptoms, right? You have to be hyper vigilant and obviously know that if your child has red eyes, swollen extremities, has a fever, has symptoms of Kawasaki, that they need a COVID-19 test. There's some link that people are putting together now.
In regards to, I know for a fact, Lolita, we can't answer that question in regards to how the baby is doing. I would say because of a lot of the privacy matters. But one of the things that I guess going back into regards to the testing, and I appreciate that Brownsville has been very proactive in regards to testing. But at this point, I mean, I sort of became a little bit discouraged after Spanish Meadows because of their negative testing, and then all of a sudden we find out that we have positives. Can we actually trust testing now in regards to the testing that's going on at the nursing homes or testing in general? Is it only telling us a fraction of the complete truth that's out there?
So I think in mitigating the disease, you need testing, and so like I told you, there are a lot of false negatives. That is common. It's hard to say the percentage. It could be human error technique. It could be enough of the virus in the system. So we don't rely just on testing to make a diagnosis on a patient. So we have to be very good clinicians and know, do we suspect COVID disease in an individual? Have they lost their sense of taste or smell? Have they had fever? Have they have all the symptoms that they had any close contact? And they test negative. Well, guess what? Let's retest them. There's options. We can look at antibody testing too. So it's important to be. This is a very fluid situation, and it's not cookie cutter medicine. It involves a lot of process thinking, and I truly believe the testing has helped the city isolate individuals that are positive, and so this doesn't go and these individuals can believe it's a common cold, and they're out in the community spreading it as community spread. Now, anything has a false negative rates, and so the testing that occurred or is occurring at the nursing homes, I'm not involved with. We'll be more than happy to help anyone that needs help. So in the last month and a half, when we had our first, there was one they needed at Solara in Brownsville. They needed testing. They needed testing there. Thank God they got to test the individuals quickly. The reality is they reached out to me. We're ready to test all the residents the next day. So we have the capability to go and help. I think what happened in that facility needs to be analyzed so it's not repeated. Correct? Because this is it's unacceptable. But there is a lot of factors, and the most important thing is the communication between the private sector, the hospitals, the release of the individual, and obviously the nursing home. So there's so many moving parts, and the communication is key.
Good. Now, do you think that these children who recovered from this inflammatory disease will have after effects?
So once you're recovered, there's no proven science that says that this is anything that is life. It's something that you live for life. Once you recover from it, it's important to know that this is not something you have for life, but it is an inflammatory process, and you need to follow these individuals.
I think something that Annette has mentioned is very true. My one of the things in regards to, since we're talking about children, Doctor, and I know that there's been some testing in regards to some of our children out at the sports park. Now, would you recommend that our children, being now that there are more tests available, I think several doctors in Brownsville are now starting to advertise that they're also providing the test. Would you recommend children visit with their pediatrician or a child doctor, or continue to visit the sports park?
So the reality is, we're extremely happy that other people are testing, other clinics, other physicians, other doctors in the community. It's the more testing, the better. And so if any parent sees any child with any symptom, and their pediatrician is not offering the testing, obviously we're that option for them, and we have been that option. We've gotten several referrals and recommendations from pediatricians in the community. Today, I approve 5 tests from different pediatricians. So it's obvious that some of them are not doing the testing. We're not sure why, but we're open and ready to take care of those kiddos and do the testing. So we shouldn't leave anyone behind. And it's important to focus on testing, and it doesn't matter the age group. That shouldn't matter.
Good.
Doctor, in regards to testing, are you able to tell us if you've been seeing a steady increase or a steady amount of positives within the city of Brownsville?
So there is, what you see on the report from Cameron County Health is after they've done their contact investigation. And so those can report, if you're reporting 7 to 10, they might be backed up. And so for today, if I report 4 positives, those can add up for tomorrow or the next day. And so you might see on your reports a higher number. What we're reporting is a steady 3 to 5 a day from the sports park. Obviously, like Erasmo said, there's other clinics that are testing. There's UTRGV, so that might be a higher component.
Annalise has a question for you, Doctor. What do you think about recovering COVID-19 patients that are tested positive again. 14 sailors about the USS Theodore Roosevelt had tested positive, recovered, and now have tested positive again. They have been required to quarantine again. Do you think that we should be testing positive and recovered patients maybe a few weeks or months?
I think the antibody testing is very key. The antibody testing is important to know where people stand in their antibody production, and the viral testing, right? When someone has COVID-19, I have had people at Erasmo that come through our facility and come to our clinics. They tested positive. I'll give you one. I'll give you a quick example. There's an individual that tested positive in Houston 3 weeks ago. Then he tested positive with another drive-through system that's not ours last week. And he didn't know what else to do. He came over to us, and he didn't have any information on his test. He was just called on the phone, and they didn't provide him an email copy of those results. We retested the individual, and they're positive. So this infection can linger. It could stay in your system. The nucleic acids, the RNA of the virus, can stay in your system anywhere from 2 to 4 weeks. So if you're doing the testing too early, the retesting, obviously you're going to come out positive. So it's something that it's not really a hit or miss, but you have to understand this virus could stay active in people's nasal cavities and structures for anywhere from 2 to 4 weeks. So if you're testing too early, you're going to get a positive.
So at the sports park, we're doing the nasal swab. Is that correct?
We're doing nasal swab, 100% nasal swab. I think I put the. Can you put the number up there, Frankie?
The one with the, let me see, the graph. 1 second.
So people can. I have cases at Erasmo. People tested positive a month ago, and then the retest. The employer is requesting them to be retested to come back into their employment.
Yeah, that's a requirement, isn't it, for several agencies that hire individuals?
It depends on the employer, and so we don't get involved with the employer. But if a patient wants to prove to, obviously for their safety and for the safety of others, that they're negative, regarding what their employer wants, people test positive on the average about 30 days after the infection.
Is this the graph, doctor, that you wanted to?
I think the sports parks numbers, if possible. That was the first one there. So we have 102 positives. We have done 1,100 swabs, 1,100 sputum samples. So everything moving forward is swabs as per the last couple of weeks. These swabs are obviously very, very accurate. It is RT-PCR. It just depends on the level of the infection where the patient is at. If you're testing someone on day one, it's possible you can have a false negative. So when people test Erasmo, usually it's 5 days. It's when they get symptoms, right? Or when they had an exposure. When you have symptoms, you're already into day 5 or day 7 of the disease. So you're more likely to test positive when you have symptoms. If you have an exposure and you test a day after your exposure, it's possible that you can test negative. You see how that works?
Yes, I sure do. Shout out to Jessica. Thank you, Albert. Doctor, so I mean, my concern is, then what's the purpose of testing then? If I'm starting to I'm starting to lose faith in the testing process, because really the testing isn't really telling us anything anymore. One thing that the comment that the person made was in regards to the 14 sailors out there that, and again, we also know that in South Korea, individuals who had already gone through the quarantine, the 14 and the 7-day one, then if we're going to have the same issue, and we just experienced it with Spanish Meadows, then what are we actually learning from the testing then?
So the testing that's being done in Spanish Meadows, we pretty much have no knowledge of what's going on in there. What I can tell you, what we've done out here is really mitigate the disease. For example, all those clusters that you're seeing, when I call someone that they're positive, and we run down the questionnaire that we talk to them about their diagnosis and what are the next steps. We ask them, anyone that you have had contact with in the last 14 days needs to do a questionnaire, have them do it and get tested. And so we're identifying these individuals in these clusters, and they're being separated and they're being isolated and being referred to Cameron County Health. So the testing, don't lose faith on the testing.
Okay.
If we don't test, we don't know. That's the most important thing. If you don't test, you are blind. Now, if you get a negative test and there's many reasons why. Sometimes what we do is there's positives in the family, but one person's negative. Frankie, if you have all 5 members of the family positive, and there's one member that tested negative, what would you think from learning from what we're discussing? Is that person truly a negative or truly a positive?
More than likely a positive, just didn't test.
It's a presumptive positive. So what do we tell that individual? Everyone is in quarantine and self-isolation 14 days after your resolution of your last symptom, not from the date of the test. Everyone gets a information and discussion with a practitioner, licensed provider. You have to be medically isolated 14 days after the date of your last symptom. It's important to understand that the testing allows you to isolate individuals that could be possibly mitigating the disease, spreading the disease.
And Doctor, then it is a huge mistake, huge mistakes to have graduation in the city of Brownsville.
Yeah, so mass gatherings are having issues. Houston had couple services where people had some gatherings, and unacceptable. You know, there's 5 positives. It's just important to know that mass gatherings, like you mentioned, from BISD, in this point in time, should be non-existent, and unfortunately, it's an issue that you're facing and we're facing. So, I highly recommend that doesn't occur. If it does, try not to be a part of it, because you're gonna be exposed. 1 out of 20 people has been exposed.
Yeah.
There's people out there that are exposed and are asymptomatic carriers.
Yeah, it's too dangerous. I mean, if we're learning that individuals may carry it for a while without testing positive, without checking in, anything else. I mean, who's to say that those 1,000, 2,000 people that are going to be congregated there at the sports park, not the sports park, at Sam Stadium, aren't going to be carried? And I want to ask these questions because they're asking them specifically to you, Doctor. In regards to Solara, there was 1 death. I think no one has tested positive as of yet, but again, we don't even know if that's accurate or not. I entered in a little late. Dr. Eder, do you think this will stay for long term? And the testing is just to control the virus? Because it's possible that they can get it again. So basically, there's no cure. They get tested to know what other precautions to take. Is that correct?
So when you get a diagnosis of COVID-19, there's obviously measures that need to be followed for that individual's medical plan of care. Most people do well with home isolation, symptomatic care. Some people need hospitalization. And so it's important to know and to test. We can't be guessing. We need to know what the patient has. So when you get a positive test, it allows the medical provider to make the most appropriate medical decision for those patients, and not be guessing if they're positive or not. You get your test, know your results. If you've had any exposure and if you got a test, you obviously have to be in medical isolation, so you're not spreading this in the community until you turn out positive later on with a fever if you tested too early. It all comes down to, are you following what the medical personnel is telling you to do?
Recommending, which a lot of people aren't, unfortunately. What is the course of care for patients, doctor, testing positive aside from self-quarantine?
The course of care, it depends, Ryan, on the age of the patient, comorbid issues. You know, the issues that get people into problem is age, diabetes, hypertension, obesity, neurological issues. So depending on the comorbid issues, their state of health, it is a course of treatment that a person can follow. For the most part, there's a lot of different theories and treatments that different groups are different societies are around the world have really taken into. We recently found out that President Trump is taking. He mentioned he's taking hydroxychloroquine, and so the FDA came out 3 weeks ago and said that it was somewhat unsafe to take outside of the hospital system. And so there's so many conflicting information. We're left to our best medical judgment and obviously following whatever minimal guidelines that we have. So we have to continue working together. Testing is extremely important, and do not lose faith in the testing only because you cannot know what you have until you test, right? And so once someone tests positive, then you know what to do with people around them. Once you test positive, you can be that bigger person and write down all your contacts for the past 14 days, and guess what? They need a test. They can go to Walmart, they can go to HEB while you're shopping for your groceries, and they can be spreading the disease. So testing is obviously extremely important with mitigation and isolation.
Awesome.
Now, the actual problem at the nursing home, that's another monster, and that is an elephant in the room. And I just hope and pray that the correct individuals are involved to make the best decisions for those patients.
Can the doctor repeat what he said about the gyms yesterday? Did you mention something about the gyms?
Yes, Mr. Mark. So obviously the virus spreads through secretions, and the virus is active when people sneeze and droplets. So it's highly likely to have high transmission at gyms because people sweat, people cough, people sneeze. Uh, weights are reused. I don't. You cannot properly sanitize gym equipment without ultraviolet light. 50% of chemical disinfection with Clorox, bleach, ammonia, everything that's used for disinfection is not important for full disinfection. So imagine if you go and you touch some barbells or some dumbbells to someone that is an asymptomatic carrier, you're gonna get it. You're gonna get exposed. You're gonna get infected.
Are patients being given our prescriptions for Plaquenil or COVID positives?
Prior to FDA recommendations, it was something that was being done as an outpatient. Is important, and so uh, at this point in time, it really depends on the person's medical judgment. We don't have mandates. There's clinical guidelines and recommendations, but as a clinical practitioner, you make the most informed consent medical decision for that patient depending on their issues.
Appreciate it. We believe COVID-19 is here to stay. When you get sick and go to the doctor, you will get tested for flu, AB, and now COVID-19 respectively. Take the meds given for whichever diagnosis and quarantine if COVID-19. So quarantine is the only thing that we have, doctor. Is that about right?
Social distancing, quarantine, separate yourself from other individuals. A lot of our positives, I won't mention the clinic name, but they were being seen at a local clinic and they were going in with fever and flu symptoms. They were running flu tests and running a streptococcal test. They were testing negative, being sent home. They went through our drive-through system. They tested positive for COVID-19. And so it looks like a flu, but it might not be a flu. It's possible that it's COVID-19. We need to test those individuals. It's highly important that we test individuals so we can know. Because in theory, those patients that were in that facility with that positive patient has now been exposed. So do not lose faith. Get a test if you can get a test. Isolate yourself. Be vigilant and be compassionate about others. You don't want to get other people sick, and you need proper medical care.
Thank you, Doctor. Erasmo, can you please ask Dr. Hernandez something Does he think it's a good idea for the Head Starts to open summer school in July, or for the 4-year-olds?
We're also finding out that children carry the virus as asymptomatic carriers, and so if we congregate all these children without knowing their status on if they're carrying the virus or not, that one child can go and sit with grandma that lives at home, Frankie, and expose the grandma. She's 80 years old, a great grandma, and now she's a high risk for mortality because we open up daycares.
So I mean, in your opinion, I'm taking that we're just moving a little bit too fast.
Opening gyms is an issue. Opening congregation areas of children, opening the schools is a problem. It's a problem if we don't know their status on the testing, on their tests. We don't know if they're positive or negative, if they're asymptomatic. Um, I would not send any of my children in this point in time to school.
Thank you, Doctor. We got 1,000 questions, but I know you have limited time, sir. If you can stay on some more, that'd be great.
Sure.
Awesome.
Let me ask him very quickly before we continue with this, doctor. We recently got word that over 100 million people in China were facing a re-lockdown again. Is there a possibility that something like that in the central hotspot where this originated in China, they're experiencing a new shutdown? Is it possible that the United States will get a resurgence that's probably even more dangerous, or is this something that is expected with the second flu or the second wave?
So coronavirus, the reality, guys, is that there's several types and strains of coronavirus. So it's important to know that coronavirus, it originated in Wuhan, China, but the reality is there's different type of strains. Now, COVID-19 is a novel virus. It's a virus that is new. So you can test positive if you had any of the other strains, correct?
Right.
So we need to know that COVID-19 is a novel virus, but it has brothers and sisters. Does anyone remember MERS?
Yes.
Okay, so that is a COVID, that is a corona type virus. So we have to understand that. And yes, on this question on coagulated plasma, it's important to do antibody testing, because if you are positive for immunoglobulin G antibodies, it means that you have had an infection and you carry antibodies that can be life-saving for patients that are in acute infection in the ICU.
And again, yeah, it's I think one of the things that's very important to understand, and I guess you've stressed it out tonight, it's a novel virus. We're still learning. We're all going to go through a process. Hey, Papa, how you doing?
Good.
Good
Come
to
on,
see
just say
Hey.
you.
hi.
You staying healthy?
Te hablan.
Say hello to the world.
Are you staying healthy?
Yes.
Awesome. Are you okay with not going to school?
What?
Is it okay that you're not going to school? You miss school?
I miss school.
Well, hopefully soon, Papa. Okay. Good to see
Okay.
you. Papa. Good to see you.
Good to see you.
So another thing to discuss, guys, is we recently opened our practice again for appointments, and we're being very careful. Anyone with COVID-19 symptoms need to get a test before they come in our facility. If you're coming in for refills, medications that are needed, those patients need to come in with a mask. There's minimum standards that the medical board has outlined on their website for doctors, PAs, and nurse practitioners to perform to practice medicine. And so, if you don't have the proper facial covering and mask, you cannot be seen in the clinic. Another thing we're seeing, there's an increase of patients coming in for mental health issues. Today, I had to prescribe, anxiolytics, anti-anxiety medications, antidepressive medication.
Goodness.
It is an issue. People are coming in with FMLA paperwork because they're now unable to work because they're so deep in a depression because they're stuck at home. They don't see the sunlight. They have financial issues. They have struggles at home. They're scared of the virus. They're confused with different propaganda, different news, political parties blaming each other, testing, testing issues. People have a lot of confusion, and it's creating a lot of mental strain. And so it's important to know that if you have any doubt, any question, there's different models and and phone numbers you can reach out to, that they're crisis numbers, and I'm going to provide you those with those
Awesome.
numbers. There's for the state. There's numbers. You're not alone. This is a novel virus. Be extra careful and vigilant. And it is very common to have something similar. Women go through something similar called postpartum depression. After having a baby, they're locked inside. Everything is gloomy. They don't see the sun. I recommend that people go outside of their home in a careful situation, not with large congregations, but go outside of your home, pick up your mail, walk around, take deep breaths, see the sun. Okay, look at what happens in Alaska. People have seasonal affective disorder and high amounts of depression. They only have sunlight for a small amount of hours in the day. So sunlight is important. Be extra careful, and go out of your home. Go out of your home. See the sun. Stay within your premises, within your yard. Do not be just locked up in your home if you're having any type of depressive issues. Try to step out of your home. If you have questions, there's many clinics that can help you. And so we are seeing a large amount of people coming in for mental health. Today, I had a minimum of 5 people consult just
Wow.
for mental health.
And I would dare say, Dr. Hernandez, that for every 5 people that you see, there are 5,000 who are not seeking help.
Oh, sure. There's some people that are they're not willing to speak up because they lost so much faith in the system. They lost faith in the testing. They lost faith in the political governments. They lost faith. The reality is, keep fighting. Don't lose faith. Know your status. Test. Help everyone out. This is a community engagement. I'm not an expert on any matters. I'm just trying extra hard to protect our community. I'm not a world class virologist. I'm a local guy from Brownsville that's worked very hard to be where he's at, and I have thousands of patients that depend on me. I've been in practice for almost 13 years. I've seen over 50,000 patients. People depend on me, and my family depends on me. So if we can test and isolate individuals that can go and spread this and provide help to patients, we're going to keep doing it. Now, can you put that picture of how we're in the office, Frankie?
While Frankie's doing that, Doctor, I have a one quick question that came in via message. Doctor, are y'all contracted through the city? Are y'all considered employees of the city of Brownsville, or you contracted to work as a private contractor?
We're an independent contractor. We're not employees of the city of Brownsville.
Okay, good. That helps in regards to not being part of that political.
No,
that might-
the reality, we're following CDC guidelines. We test who needs to be tested. We don't have government officials telling us who to test and how to test. If you need a test and it's medically necessary, I'm going to make sure that we do our best and possible to get you the test, no matter who says what.
Good.
That's the end of it. People need a test. We can get you a test. We can help you. You're not alone, and we're in this together.
Amen, brother.
So this is me at the office. I'm wearing an N95 mask that is extremely hard to get right now. My glasses, my face shield, and I have this protective gown. The issue is that we're going through in the medical community. 20% of all infections in the United States are coming from healthcare workers.
Wow.
Frankie, what does that tell you? That tells you that we we don't have the proper tools to fight this novel virus. We have been in back order for gowns, for goggles, for gowns, for our private practices. It's very difficult to provide help to individuals if we don't have our proper tools. And so recently there was some information that was posted in Brownsville Living. There's some medical professional, and I won't mention her name, but she was very adamant about that there is PPE. Guess what? 95% of people in the United States that are trying to get PPE are having trouble getting their personal protective equipment. Now, we need to find ways. If you go to the supermarket and there's an individual that's coughing and you have your surgical mask or you have your N95 mask, do you believe that mask might be contaminated?
Wow, maybe.
So then what will you do with the mask? Would you discard it, get a new one, or will you attempt to sterilize that mask?
Sterilize it as much as possible or burn it.
So you can and look at this man. This guy Ryan is getting it. Okay, this individual was trying to have conflicting information. Okay,
Yeah.
regarding sterilizing masks. The CDC does recommend for you to decontaminate masks in an area of shortage. Correct,
Right.
Ms. Vela? So this individual, and she's a local healthcare provider, was very adamant about how that we can get it. It's very simple to get. It's not simple. It's not easy to get. Everything, there's so many roadblocks that we're going through, and it's very hard
Well,
to deliver the care that we can.
I'll tell you what the first problem was, Dr. Hernandez. The first problem was people actually going to Brownsville Living to get information when they don't post the truth out there. All they post is everything's great, everything's amazing, everything's peachy keen, and oh yes, there's PPE, there's everything, and there's gold at the end of the rainbow.
Yeah.
De nada sirve to tell our people lies. Let's tell them the truth. Let's tell them what the situation really is, because that way, Dr. Hernandez, they'll start to appreciate a lot of the hard work that you and your staff are doing out there, instead of throwing what y'all say to the wind.
Now we commend the city. They do have and they do provide appropriate PPE for our staff while we're doing the tests. I'm talking about the issues in the private sector. The private sector, there is extremely hard getting personal protective equipment for individuals. It is hard. Now, we are sterilizing. The issue with
Good.
sterilizing is if you sterilize a mask in an autoclave, which we have several autoclaves in our facilities, you affect the filtration of the mask, which means that you can get an infection by COVID-19 virus because now you affected the filtration of the mask. You have to find ways to sterilize the mask without affecting the filtration.
Yeah.
Right. So Ryan mentioned it, the importance of possibly using like a steamer, a baby bottle steamer produces
Wow.
Microsoft generated steam. It's on the CDC website. It is a recommended way to sterilize personal protective equipment. And here we have another individual, Iris Cavazos. She's an excellent individual. Her husband's a dentist.
I love her.
One of the best dentists in town. Those people that were trying to dog on me, one of them is a dentist and the wife is a pharmacist. The reality is they claim that there is PPE. It's very easy to get, that we can actually order it, that you cannot sterilize it. But guess what? This is a pandemic. This is a horror sci-fi movie, and we're living a reality. Open up your eyes.
Amen.
It is not cookie cutter. It is not cookbook. We're writing the rules as we go. We're writing a novel as we go, and we're here to help each other. So if I develop a way and I use the baby bottle steamer to steam my mask because I'm limited in my mask and I don't want to bring that infection home to my children and to my wife, we need to take precautions into our own hands. Now, there is an individual, her name is Sarah Phillips. Her husband runs a Texas entity that has gotten over 70,000 N95 masks for individuals.
Wow.
And I applied for it. As soon as she brought it out, she mentioned that she had told officials in the city about the project and about the funding for these things, and it's free. So I ordered it. I'm still waiting for it. She said it would be ready within 24 to 48 hours. I still have not received it. So I'm going to check in with her tomorrow. I ordered 1,000 N95 masks. My numbers are high because we want to continue seeing patients.
Yeah, sure.
So I'm going to provide you guys with the link this evening for
Please.
you to be able to sterilize not only your facial mask.
Yes.
If you have an N95 mask, try to sterilize it. Hydrogen peroxide, spraying it with hydrogen peroxide, 99.9% effective, guys. Who doesn't use hydrogen peroxide, and how inexpensive is it?
Very
Extremely. So just by simple methods, we're able to help decontaminate things that can get you infected. N95 mask is a respirator, particular respirator machine mask that prevents particles, infectious tuberculosis viruses for Mr. Manning.
Thank you, my man. What can we get tested without having to wait to get to see if we qualify to get tested? btxcares.com. B as in boy, T as in Tom, X as in X-ray, cares, C as in cat, ARES.com. btx.cares. Fill out the questionnaire. Very simple. They'll get back in touch with you in less than 24 hours, I would say. Maybe 24 hours, Dr. Hernandez.
Yeah, we're very aggressive. In the reality is, here's another nurse. N95 masks are for airborne diseases. It's a respirator. It's not just for TB. So there's simple ways that we can help each other is by the knowledge that everyone brings. Common sense. If you have a mask that is contaminated, you're going to contaminate yourself and your family. You should not be reusing those masks if you don't have any way to sterilize them. Vapor, steam helps it.
Dr. Hernandez, you're so knowledgeable. You have an answer, professional evidence to back up your answers. You have answered every single question from Erasmo and the community, and you have responded to every single question. That's why the community and my husband believes in you. Preach. We need more doctors like you, caring, extremely knowledgeable of their profession. I like what you do. A lot of research. Thank you. God bless your family. And I concur with the sentiment, Doctor. You're an amazing asset to our community, sir.
I appreciate all the those amazing remarks. That's what keeps us going as professionals. And like I mentioned, we're not subject matter experts. We're just someone that actually cares about the community. We need tests. We need people to stay open. It was a very hard decision to open up our practices because now
But we need them.
We need them.
Yeah.
And it's important to know how to do it carefully. Tomorrow we're having a provider meeting. We have 2 medical doctors on our roster and 7 advanced level practitioners. We're all going to meet and provide ways to obviously countermeasures against COVID-19. We're now offering antibody testing, and so the antibody testing is the next best thing for a diagnostic tool in regards to COVID-19. So you can use it as a complement, guys. You can have your PCR testing, but you can also get your antibody test. If you have antibodies against COVID-19 and your PCR is negative, what does that tell you, Frankie? What do you think that tells you? If your antibody test is positive, IgM and IgG is positive, and your PCR test is negative, what do you believe that tells you?
And you're in trouble.
PCR tells you active virus, and the antibodies are the antibodies that you're producing to fight that virus. So if those are positive, you have been exposed or you have the disease.
You're in trouble.
either the test was done incorrectly, there was a lab error, there was not enough virus. So antibody testing is important. We are offering antibody testing through our facilities. We're rolling that out effective immediately. So any antibody test that people have questions, they can call us to our facilities.
Doctor, what can you got the question? What can doctors do to influence the district to keep kids and personnel safe?
I don't believe we have any say so with the district. We would love to have a Zoom meeting. If you guys can set up a Zoom meeting with them,
Very
we can. Uh,
possible.
you
They're
know,
tercos.
we
They're tercos.
be careful.
Yeah, tan tercos. And the only avenue, Lupita, that we have is November. We need to vote these people out. That's the only avenue because these people have disregarded everything only to protect the individuals that continuously steal from our district. And yeah, it's if it's not evident now that they don't care, that they're only interested in financial gain and not in what's in the best interest of the district. Look, I'm going to say it. Dr. Hernandez has been very kind. Dr. Hernandez, and I know this for a fact, Dr. Hernandez went to present to the board, and they disrespected him on that board. They disrespected him, and let me tell you, when we went to the back, I told them off because there's no way to treat individuals who are just helping our community. And Dr. Hernandez is not going to let me lie. I mean, they tried to disrespect them on that board. And it was the same people that are on there now that are part of that little group, the corrupt group. And I apologize that they did that to you, Doctor. It was completely uncalled for.
You know what? And that's when that occurred. Obviously, there was hidden agendas,
Yes,
and the reality is, they don't make me or they don't break me.
preach.
My work speaks for itself, and we were doing something good for the district. We will continue seeing district employees. We believe in the district. We believe in the employees. We believe in the students and the teachers. I don't believe in the actual management of these individuals with political agendas that should not happen. At this point, we don't rely on those individuals for us to do what we need to do.
Preach it, bro. And again, there have been plenty of classes being offered to help medical and dental officers to back to work safely. If they think they can get back to our old ways of seeing patients, we are running the risk of getting infected or infecting others. Minimize overlapping patients. Have everyone wear a mask. Question them regarding their health and possible exposure. COVID. Iris, I love you, Iris. Remember November. That's too bad. Encourage the nurses. November is well into the new school year. Preach. I'm sorry. I'm so sorry, Dr. Hernandez. You don't deserve that, and she sure as hell doesn't. When do you believe will be a good time to actually start school year? August. I'll give you my opinion. My opinion is let's wait till January. That's my opinion. Let's wait till January. By then, we should have a little more, a little bit more in tune in regards to what's going to happen. Continue with distant learning as much as possible for August. Keep kids at home. No se van a hacer nada if they stay at home for an extra 3-4 months. Keep them at home and let's see what happens in January. You know what?
We
Where's the
we
rush?
ha- we have some good news. Anderson Cooper last night brought over a individual that was the first or second individual in the U.S. to get the vaccine. Okay,
Right.
they're following him. It's called the Moderna vaccine, and it's important to know that there's people out there that these trials are going in. So we're already examining a remedy, a vaccine that will help. So don't lose faith. The system is working. When you have questions, reach out to a medical professional that you are comfortable with. Be comfortable with your provider. Ask them the question that you need. And the reality is, if you cannot get the answers, look for someone else that can give you the answers.
What is the cost of the antibody test? I'll say right now, the city of Brownsville for Brownsville residents is picking up the cost. If you have insurance, they'll bill your insurance. If you don't, the city of Brownsville will provide the exam here in the city of Brownsville residents at no cost whatsoever.
The antibody testing, there is no City of Brownsville antibody testing that has been approved. They are doing the most effective diagnostic test, which is the RT-PCR.
Okay.
The antibody testing is something that I want to offer to anyone in the community as a complement. if you want to know your status on your antibodies, that's something to know if you believe you've been exposed. And that, did you see what the Governor Cuomo did in New York? What did he do? 15,000 antibody tests.
Yes.
He took a population sample and decided to see who had been infected, because those people are now semi-immune or have memory antibodies. We don't know what immunity is with the disease. It could be that you're immune for life, or that you're not, you're immune for a certain amount of period.
Yes, Shayna.
But that is happening now.
Yes, I have to take a COVID test before surgery. Does that count as free? If you do it at through btxcares.com at the sports park, I think you should be good. Is that correct, doctor?
Put in the comments, put in the actual patient comments. I just don't look at the symptoms. We actually look at the patient concerns.
And again, I guess to my friend Shayna, it is going to be a concern. Thanks for clarifying, Doc, and I do appreciate you. Thank you, Shayna, and thank you all for all you do. Thank you, my friend. Love you. Uh, and Dr. Hernandez, is there anything other that you'd like to share, or I mean, we'll keep you all night, Doctor. Trust me.
No, just I know you guys have concerns on the actual nursing home response. I had calls today with the public health director from the city of Brownsville. I'm being included in that.
Good, finally.
And so that's important. But I will give kudos to Art Rodriguez. He has been working day and night looking at ways to mitigate the disease. I don't know if you've met Art Rodriguez, but he's an excellent gentleman, and he's actually very kind. He's working, figuring out strategies to minimize the disease, and he's been very active. I'm proud to say that they're gonna figure it out sooner than later. We just have to work with these individuals, and they have the experience. Believe it or not, we have a lot of people with experience. We just need to listen to the right people.
Well, I'm going to give him another chance just because you recommended him. So I'm going to give him a second chance, doctor, just because you're recommending him. What does this antibodies test consist of? Blood work, swab, etc.
It's a very simple blood draw or a finger stick. One is ready in 15 minutes and one is ready in 24 hours.
And Ryan, what I'm referring to is let's continue distant learning from home, but let's start perfecting it now to the point that we could be a little bit more effective in regards to it. In regards to if you have to have a lot of students come in, minimize the number of students that you really, really have to come in. But the problem is with this district is you tell them minimize, y no, hombre, vientan a 100 huercos por clase. That's the problem. So focus on distant learning. Try to bring back more people to the campus, more students to the campus back in January. That's just my take, Ryan. But I understand what you're saying. Thank you, Erasmo. Thank you. Sports Park for antibody tests as well.
At this point in time, they have not discussed antibody testing. The antibody testing is something that we're doing out of our private office, effective immediately.
Awesome. And Dr. Hernandez, your work ethic, dedication, and patience, loyalty are great examples for how grateful we are to have you in our community healthcare system. Preach. I agree.
Excellent.
What if they are infected in mid-February? Is that too far off, or will tests catch it?
Your antibody test will be able to tell you if you were truly exposed and if you have antibodies.
Now, give un historial, un good historial of what's been going on. Is that correct?
Yeah, the antibody test is going to tell you did you have it or not.
I'm being asked where your office is at, doctor. I know that you have 2 offices here in the city of Brownsville.
We have 2 offices in Brownsville. One is on Boca Chica Boulevard. The number is 546-2000. The second office is on Alton Glore, where the old Jones Liquor used to be. That is not a liquor store anymore. It's a medical office, Erasmo. So that's 518-7444. And I also have another office in McAllen. We service McAllen as well.
That's amazing, and I'm sure that McAllen is very, very fortunate to have you out over there. But we want to keep you here in Brownsville, sir. Especially when teachers also have their kids at home too. They'll give each secondary 150 plus kids. Did he work for Dr. Thurber? I'm not sure.
Yes, I worked for Dr. Thurber maybe like 10 years ago.
Guys, phone number on Boca Chica is 546-2000. That's very easy to remember. Is that correct, Doctor?
Yes, sir.
546-2000. Very easy, guys. Help the students have a positive experience. Preach. This was a very well informed evening. Need more of this. No one else is doing this that I know of. Thank you, Dr. Hernandez. Amazing work. Elton Gore and also McAllen off the expressway. I guess someone from the office is out there, Doctor.
That's actually my sister. She's a nurse.
Oh, Lisa. Good. Yeah,
Awesome.
I think I've met Lisa. Great show. Thank you guys. My kiddos and I all had respiratory infections between November and March. We were negative for flu and strep then. Are we candidates for the antibody test?
Yes.
So
Yes.
contact your office. Is that correct?
Correct.
Appreciate it. And Maida, the number was out there. Dr. Hernandez, you are here to stay. Woohoo! In Brownsville.
Not
Thank you,
Wuhan, but
Dr.
woohoo.
Hernandez. He did an awesome job. Thank you, Doctor.
That was a long time ago, guys. Well, I appreciate it. I'm gonna get some dinner.
Doctor, have a great meal. Thank you for being on. Your time is gold, I know, but you're my friend, so I know that I know that you share that with your friends and again with our community. And our community, as you know, they appreciate you, Doctor. They appreciate you coming on and giving us this time. So keep it up, man. You're doing an amazing job.
We're trying as hard as we can, and we're willing to learn and work with others that want to work with us. This is not about ego. This is not about anything else, but working together and helping fight COVID-19. This is an invisible virus. It's an invisible reality that we have to face.
Again, you're very much appreciated, sir. Thank you so very much for everything that you do. Again, go have a great meal, Doctor, and come back and spend some time with us whenever you can. It's your call.
Okay.
God
Bye,
bless.
guys. Thank you. Bye bye.
Guys, before we sign off today, there's a couple of things that we should go into really quickly, and thank y'all, most of y'all, for staying on. Guys, one of the things that I think came out in the news just minutes before we got on, besides the new numbers, is that border crossing has been suspended till June 22nd. So, in regards to individuals coming in from Mexico, there will be no coming in from Mexico for people that are not residents or U.S. citizens. So no one was coming in from Matamoros to come and visit. And I know had to eat my barbecue dinner. Well, thanks a lot, John. Still waiting for the invite. No one can come in. And again, thinking about what the situation is, it's really going to hurt our economy. Take that into consideration. Our economy is going to suffer. It's going to take a hit because a lot of the Chinito stores downtown, coronavirus.
Coronavirus.
I'm going to hear that from President Trump. Well, why did you mention Chinito stores? Like that reporter. No disrespect to my Chinito people downtown. I love my Chinitos. But guys, the economy is going to hurt and suffer. No people from Mexico can come and do any shopping here. So guys, let's be careful. That's something to consider. There's one more thing that I wanted to talk about, Frankie. Is that true before we leave?
Let's do it.
I had something else. Guys, remind me. Oh, Todd won the voice. I don't know how the heck Todd won the voice. I wanted Micah to win, but it is what it is. But Todd, I guess Todd won the voice. If you are a U.S. resident or have permission, do you hear? Yeah, you can cross permanent residents or citizens. But here he is, Martha. He is a PA. I'm sorry to miss your question. Dr. Hernandez is a physical PA. Yes, 100%. Do y'all know when is the DPS? No, actually, I get that question a lot. We do not know. It hasn't been stated. See, that's one of the things that really trips me out. The governor's out, open, everything. But the state offices, they're still closed.
They're closed.
That doesn't make sense to me. Why is it everything open? Pero the state offices closed.
Because they know the truth.
They just shut down the bingo hall in Brownsville. Well, they should. The other thing. Sorry, Justin. I hope you're still here. The question that regards to Justin was asking in regards to unemployment, guys. If you are receiving unemployment from your employer because of COVID-19 or being furloughed or being laid off, and then he calls you back into work, and you say, I still don't want to go into work, you can lose your unemployment benefits. You can lose your unemployment benefits. So again, yeah, see ya 9 tomorrow. Tomorrow, 9 a.m. in the morning, 9 p.m. at night. Thank you. It makes sense because if the cops shut the bingo hall right now in Brownsville, then they will shut the bars and etc. It doesn't make any sense. How today I saw a video of someone that had a bar and they had to wear these like inflatable tires around their waist.
The tubes.
Yeah, some tire tubes. All they want is power. That's crazy. Is he a? We already said that he's a PA. Thank you for the clarification. Thank you. Sorry, Martita, and I might have missed your question. Gucci Gang number 1. Jorge, I need some sunglasses. Erasmo Castro and Frankie, thank you for all you do. No, thank y'all. Thank y'all for being here with us and really clarification. Martita, thank you so much for being here as well. Guys, we're doing our best to try and keep individuals informed of everything that's going on. We're trying to post the numbers as they come in. Also have any discussion. We don't always talk about BISD. We don't always talk about what is another. I know some people are saying like, oye, vinimos a oír lo de BISD. And trust me, people are like, Erasmo, you didn't say anything about BISD. Guys, the only way that we're going to maintain ourselves relevant and significant is we do our best to touch all topics, because this is a reflection of what our page was before. Our page is of the happenings, the current events of the day. The reason is BISD still doing lunches. No, I don't think so anymore. Guys, the only reason that BISD has been such a hot topic is because they totally screwed everything up. They totally screwed everything up. So it was like, and I told Frankie, I told other people, they're like like Christmas to me, the gift that keeps on giving. Pura regazón. So it's kind of hard not to talk about them. And I told someone today, I said, hey, we talk about PUB. We talk about PUB. We've talked about TSC. We've talked about the port. We've talked about everything. El problema es BISD was just giving us a lot of material to talk about. Tons! ¿Para cuándo el otro cheque? I think we are going to get another stimulus check. I dare say probably closer to June, July is when we're probably going to get another. Is a PA and a medical doctor? I'm not sure. Stilettos is opening. I have my sanitizer and rubber gloves with gloves. Yeah, Ryan, use a hole punch. And check it out, check it. I think June or July. Spanish medals again. I know it seemed like I was fighting Dr. Hernandez. I basically just wanted to get those questions answered in regards to Spanish medals. I'm concerned about Spanish medals, guys. And you know what's funny? It's not funny, but you know what's interesting? Frankie, we were talking about this months ago. It's probably going to, maybe 6 weeks ago. It's going to hit Brownsville. We're going to get a nursing home, and it's going to start to blow. And I think those pictures had a lot to do with it. I think what's starting to happen is that they were trying to keep everything very, very hush hush. The problem with Spanish Meadows is that we didn't receive a voicemail recording like we did for Veranda. Quiero que sea Navidad para estrenar mi Facebook con poquitos, mi face mask. Had a parade down Price and Perez like Line Road. Monday was very cool. BPD did a good job with traffic, and seniors really looked happy. Yeah, I love my Hannah seniors. I love my Hannah seniors, and I love my Browns Police Department. Great people. The stimulus check, they said, supposedly supposed to be deposited on the 20th. Congratulations. You can take me out to eat then. Mañana me invitan a comer o a cenar. Una entrevista en español con el sábado. José, vamos a tener una entrevista con el doctor Mario Cerdán a las 3 de la tarde, Frankie,
Yes,
con
sir.
doctor Mario Cerdán en español, José. Ahí le encargo que esparrame la palabra. Vamos a hacer una notificación ya cuando nos confirme el doctor para que ustedes la puedan compartir con el pópulo. Gracias. There are more than 20 people with the Rona already and more than 7. Yeah, man. It's not a good thing. It's not a good thing. Actually, the numbers I think say a little bit less, but I wouldn't doubt it,
Yeah.
Sandra. And that is an issue, a bad issue. Put a lock on Spanish Meadows and leave them in there for 40 days and 40 nights. Bien biblical, my man. Manny, tomorrow we're doing Rudy's, Manny. Before 6 o'clock or after 8 o'clock, Manny. Rudy's. We love you a lot. That's Fernando. I love you too, bro. And we respect you. Thank you for everything you. I thank you, man. I love you. You know I do, and I love my community. And we'll be continuing to be out here for the community. Frankie, any last words?
No, it was a great show. Again, we're very appreciative of Dr. Eder Hernandez, as well as Mario Cerdan and Dr. Zamir. These are people who are, at the front lines, taking care of our community. So for him to take an hour of his time to educate us and answer any questions, it speaks volumes to his character and to what he wants actually, and that's the betterment of the city of Brownsville. So thank you so much to Dr. Eder Hernandez. Again,
Amen.
Going to the numbers at Erasmo, our 30th death, our 11th case in Brownsville. Again, I stress the fact that we are still seeing a community spread. We got 5 today. It doesn't seem as if we are taking the proper protocols or taking the advice from our medical experts seriously. The county is at 649, and this is only gonna get worse. Again, we're 2 weeks away from graduation. What's to say that this number was not going to double, possibly even triple? We've been eyeing the recent deaths, but with the resurgence, with the possible flu coming around, we're going to be in this mess for quite a while. Again, we get in trouble because we don't say about the recovered, but in actuality, we have no idea what recovered is. We just saw China, who is in a new lockdown. Over 100 million people are being quarantined, so to speak. So again, this is something that's going to come back. I have no faith, and I hate to say this, I have no faith in the federal government, and I lost faith in the governor. And one thing I do want to clarify, Erasmo, I'm not in favor of not allowing businesses to open up. By all means, I understand many of our friends are business owners, entrepreneurs, and that's the way they make a living. I just feel that it our reasonings for opening up so quickly have been economics and not the better well-being of the people. That's my opinion. I know others feel differently. Uh, good. Like I said, good show, good Tuesday, good happy Tuesday. We'll be on tomorrow morning at 9 a.m. Thank you so much. We had a great audience today. I can't wait to look at the numbers, but our numbers are good. Thank you so much, Brownsville, for being patient with us. We're always trying to talk about different issues that are affecting our community. Just as long as you all will have us, we will be here on every night at 9 a.m. and 9 p.m. So thank you so much, guys.
Mike, vente, Mike. Mañana Rudy's. Raymond, bro. You always got an invitation, bro. Let me know. Tomorrow, Manny nos va a llevar. What are the recovery numbers like? I think we're 200 or 300, or I'm not sure. Hold on. I could actually tell you because I did have the clip. Recovery numbers are
410.
410. 410, Manny. Just to answer your question. Oh, thank you, Araceli. Guys, have a great evening. Stay safe. Be good to each other. Be good to me, please. And be good to Frankie sometimes. Guys, stay safe. Practice social distancing when you're going to Walmart or HEB. Try not to take your kids with you. Wear face masks when you go into the public places. Guys, be very conscious. Doesn't matter what the corrupt board does. Doesn't matter what the stupid superintendent does or orders. Ultimately, you're the one that has to decide what is in the best interest of your children, what is in the best interest of your family. So please, reconsider a lot of the liberties or mandates that they've wanted to give or throw upon us. God bless. Have a great evening. Tomorrow morning, thank you, Angie. Tomorrow morning, 9 a.m. 9 a.m. See you here. Bye, guys. Love y'all.